Hello and welcome everyone. My name is Leslie Friday and I'm the Director of Content here on the Marketing and Communications team for Partners in Health. And I want to thank everyone for joining us today. We have 4 experts from Partners in Health who will be here to field your questions. We sent out a request earlier last week requesting for questions specifically about COVID, and we got a lot of great suggestions. So we are going to try to answer as many as we possibly can. First off, I want to introduce everyone joining the call today. We have Dr. Sheila Davis, our Chief Executive Officer of Partners in Health. We have Dr. Joia Mukherjee, our Chief Medical Officer. We have Daniel Orozco, who is our Chief of Clinical Operations. And we have Emily Daly, who is our Director of Impact. So each will take a turn answering questions that our audience has pre-submitted, and we'll just jump right in. So the first question that we received here is from Shirley. And Daniel, I think you would be best to answer her question. It's about PPE. So she asked, there's a lot of concern about PPE shortages in the US and around the world. What is Partners in Health doing to ensure its facilities and partners are well stocked with PPE to protect frontline workers and patients? Go ahead, Daniel.
Thank you, Leslie. And a very important question, and certainly a challenge that we are experiencing everywhere. It's not only in the US hospitals, but it's becoming more and more of an issue everywhere, especially in the countries where we are working. So we are responding globally to this pandemic, and we have initiated procurement of PPE supplies as early as early February. We have placed 2 orders, one in February and one in March, that are in process right now. And they are being requested from international vendors that we normally use to place the orders for our routine work. We are currently working on another order of a large amount for PPE to try to diversify our options. The problem is that given the global shortage, we cannot rely only on one manufacturer or one supplier. We have been trying to explore the different options for the provision of these PPE supplies to our sites. And also keeping in mind the safety issue. There are more and more evidence and conversations about the quality of the PPE, which is a concern. We are always, of course, aiming to provide high quality supplies, but given this current situation and the pressure that the entire world is experiencing about the shortage, there is unfortunately already evidence of the poor quality of the PPE supplies or the testing as well. And we are making sure that we request evidence also from the suppliers about the quality of especially the N95 masks to protect our staff while they are doing their work. So we are in this process right now. We are expecting that in the coming weeks there will be the first large order that we place in February will be arriving to our sites. This has we need to consider also that the challenges are with shipping the supplies to the countries, because borders have been closed already in the majority of countries several weeks ago. There are also restrictions for importation. There is less and less channels for delivering the supplies to the sites. So it's not only the manufacturing capacity or the quality, it's also all the logistical challenges that we are experiencing. We are exploring different alternatives for transportation of the supplies via air cargo or sea, and we are in collaboration with agencies like UN Logistics to identify how can we capitalize on international channels for supply that are already available. We have already some stock of supplies that we had from before in our response during Ebola in West Africa, and we are making sure that this is being delivered also to our sites. So in summary, we have different alternatives. We have explored how to diversify the supply chain. and expecting that as of the next week or the week after, we will restock our supplies for the countries where we work. Thank you, Les.
Thank you, Daniel. Let's move on to the next question. So we have a question from Elizabeth, and I think Joia, you might be best placed to answer this one. She says, hi there, my question is, why is COVID-19 so much more dangerous than, say, the regular seasonal flu? Is COVID-19 something we can expect to affect us long term, say 6 months plus? Joia, if you don't mind taking that one.
Yeah, thank you so much for that question. And it's a great question because I think what we always want to do primarily at Partners in Health is listen to the scientists. And what we know about COVID-19 is it's a novel virus. And when we hear the word novel, what that means is it's new to humans. And so there is no natural immunity. So what we see with seasonal influenza is there's some immunity in the population. People have had influenza before, even though it's slightly different, people who've been vaccinated. And so what we always worry about the novel viruses is every single person on Earth is susceptible. And so that is why it is more severe. There are other coronaviruses, some are severe, some are not. This one happens to be very virulent. We don't know, which means very powerful, and we don't know yet what properties of the virus make it so virulent and powerful, but it is hitting a totally non-immune human population. So we don't know if it will continue to come back season after season. We know that that happens. It happens for two reasons. One is that it would continue to circulate in the population asymptomatically and pop up place to place. That's one. And the second is there's something called Antigen Drift, which is a slight modification in the virus or a mutation that would make it come back in a slightly different form that would hit the non-immune population, or even the potentially immune population. So I think we have reason to understand why it's so much more powerful, the lack of the immunity, some properties we don't yet know about the virus. And then I think it's likely that we'll see at least another season of this, like happened in the 1918 flu. But hopefully efforts to slow the spread and simultaneously work on medicines and vaccines will protect us in the long run. So our view is slow the spread, so that gives science time to catch up with this virus.
Great, thank you, Joia. So the next question is from Janine, and I think Joia will keep you on the mic, so to speak.
Okay.
So if you get the COVID-19 virus and recover, can you get it again? And if not, will we eventually build up a herd immunity?
Again, there's a lot we don't know yet because it's a new virus, and there are laboratories all over the world that are, feverishly, no pun intended, studying COVID-19. And so we will learn more. But it's reasonable to believe that once people recover, they will have a lasting immunity. We do see that in many viruses. That's why vaccines work for viruses like measles. So I think we assume that there will be protective immunity in people who recover. That immunity is, we think, antibody related, which it usually is in viruses, but not always. And that is why there are studies ongoing to pool and collect the serum of people who have recovered, something called convalescent serum, people who have convalesced, and collect the antibodies that may be powerful against COVID, and to study that and use that to try to shape a vaccine. And that's what we saw in Ebola. using convalescent serum that gives us clues to how it is people recover. And we know that just looking at what's known is that the people who do poorly and die from COVID, it looks like they are never able to contain the virus. So they die and continue to have virus. So, and the people who recover do not have detectable virus. So that suggests that the body is mopping up, immunologically mopping up that virus. And so that's being studied in these what are called convalescent serum studies.
Great, thank you, Joia. I know that's a hot topic right now too. So Sheila, you will have the next question here, and this one is from Rick. Sorry, Daniel. I've got Daniel's question up next. This question is from Courtney. So Daniel, if you could answer a question we have about tests. So PIH is using rapid tests for coronavirus. What are the barriers to the US using rapid test or other measures to fill testing needs? So if you could respond to that one, Daniel.
Thank you, Leslie, and thanks, Courtney, for that question. Certainly something that we have been navigating over the last few weeks since we started responding to this pandemic. At PIH, we outline a guideline that includes testing with rapid tests. As you know, tests have been coming through the market, the research and development pipeline over the last few weeks, and it will take still some time before more tests come to the market, because this is rapidly evolving, and we have more and more manufacturers producing rapid tests or other type of molecular testing, PCR, that is being rolled out. I would say there are no barriers only in the US. I think it's barriers globally to roll out the rapid test, but certainly here in this context, the political will, the readiness to be able to roll out the tests. There is approval processes that are very strict, usually, for example, through the FDA. It normally takes months before a test is approved. And therefore, FDA has opened a channel for fast-tracking approval rapidly of these rapid tests. There is all the research and development process for the rapid test to become available. And also, we cannot ignore that there is all the logistical challenges, same as for PPE, for distribution of the rapid tests. I think regulation is certainly something that plays an important role here. Here in the US market, the priority and the gold standard is PCR testing, and it's also what is being done globally at national labs. But there is a problem with access as well. Not everybody has immediate access to get a testing done at a central lab. And therefore, our strategy looked at the other alternatives in the market. And we are not recommending only the use of the RDTs or use the results of the interpretation of these results in isolation from other tools that might be available, including clear case definitions. So we cannot say or expect that there will be a rapid test that will be 100% reliable. There is things to consider that include window periods for antibody testing, the lower sensitivity of the rapid testing as compared to PCR, the level of viremia of the virus in the person, the sample collection, the quality of the specimen. Everything can have direct impact in the results of the rapid test. So it's really a combination of factors that accumulate and add a number of barriers for the rollout and the use, the spread use of the rapid test. At PIH, we are working to remove some of these barriers, but as time evolves, we will have more and more options. We just want to make sure that our sites, our patients have access rapidly to the results, making sure that we account for the limitations of these rapid tests. Organizations like FIND are doing an excellent job in tracking the pipeline and keeping an update about what is happening in terms of research and development, and are updating daily with recommendations of the tests that are coming to the market that are approved. There is still a need for more evidence, and that is being done in countries around the world and here in the US especially. And we are collaborating and we are communicating with global partners. Certainly, early we started conversations with WHO, with CDC Afro, with CHAI, to make sure that we align strategies and that we provide best possible tools that become available to the market. So that's our response right now in terms of rapid testing.
Thank you very much, Daniel. So our next question goes to Sheila. So Sheila, you're up, and this question is from Rick. He wants to know, as of now, there isn't a cure for this natural disaster, but what is the global medical community doing together to create treatments that reduce the effects so that infected persons can weather the impacts as long as is necessary? So Sheila, if you don't mind addressing that one.
Yeah, thanks, Rick. It's a good question. I think there's a lot going around globally to try to test current treatments that we have and create new novel drugs. There's also a lot of work being done on a vaccine, which best case scenario would still be probably a year away. And then the production would, the amount that we would need to have for the entire world would be quite big. So the vaccine, unfortunately, is probably a year and a half away. So I think what we're focusing on is getting the hospitals ready and creating isolation centers. We're really working on what can we do with limited resources that we have. And the most important thing we know to do is to test people. There's been such a lack of testing globally. And as Daniel talked about, there's many complications or many complexities to testing, and many different tests are hitting the market. So hopefully this won't be as much of an issue. But the goal is we really need to test people and then do very thorough contact tracing to find out who are the people who have been in contact with that person who's ill, and then isolating those people so they're not infecting others. If we're able to do this, this will have a huge impact on the spread of the virus. So it's a important piece of public health, community health that we need to focus on, and is something that is in this country has not been focused on as much yet either. The hospitals that we work in around the world, you know, we have IV fluids, we have things we can do to try to keep people comfortable. We're investing in oxygen to make sure that our hospitals have enough oxygen. There's things we can do certainly like that, but we don't have the advanced systems of intensive care units in most places in the developing world. So that's a huge challenge in terms of the very, very ill. But I'm hopeful that as time goes on, as Joia said, that this is because it is a novel virus, there is an army of people who are working on trying to identify a vaccine and identify treatments that we know can work. But this is going to be, I think, a battle for quite a while, and we're going to have to figure out how we can support health systems that are not as robust as many places in the US and Europe, which we have seen is also battling this and not having great success.
Great, thank you, Sheila. That was great, and thanks, Rick, for the question. Next up, Joia, I'm going to have you answer this question. It's from Benito, who you may know as well. Thanks for hosting this event. What advice would you provide to individuals rushing to purchase chloroquine for self-medication against coronavirus? So if you don't mind answering that question.
Yeah, no. Hi, Benito. The jury on chloroquine is still out. There were a couple of papers that came out today showing some impact. I don't think people using it broadly to protect themselves is that useful for two reasons. One, the data isn't particularly good, and it's not particularly good. There's no data on prophylaxis or preventive use of chloroquine. And two, there is a global shortage now in chloroquine, and we still use chloroquine for a couple of diseases, malaria in some places like Haiti, and rheumatoid arthritis around the world. So we hate to, just based on fear alone, take that medicine out of circulation for the people who may need it more, and then reserve it for carefully studied trials, and eventually, if it works, people who really need it with COVID. But I think there is kind of panic that is driving a lot of purchasing from PPE and masks to chloroquine that's harming the routine needs and uses for these items.
That's great, Joia. Thank you. And the next question is actually for you too, Joia, so we'll keep you on. This is from Melissa, and she wants to know, does having latent TB or tuberculosis put you at higher risk for COVID-19? So your thoughts on that?
Yeah, thank you, Melissa, for thinking of our patients with TB and brothers and sisters with TB around the world. This is a question we don't know. My general feeling based on science, again, is that those with latent tuberculosis would not have an increased risk, because latent tuberculosis means that you haven't had an active infection in your lungs. And we know that people who have lung disease are more at risk. Latent tuberculosis also means you have some level of immune response to contain the tuberculosis. So there's even some suggestion that people who've had the BCG vaccine may have some level of resistance. And I would say, latent tuberculosis is in some ways a bit like that. You've been exposed to that germ and your body had some response. That being said, we are very worried about our brothers and sisters who've had TB or have TB, because many people in the world who've had active TB have a lot of lung disease as a result, have scarred lungs, have weak lungs. And so we're very worried about the combination of people with lung disease from TB or having active TB and COVID. And similarly, we're very worried about what's going to happen with COVID and HIV. But I think latent TB is not a top worry right now.
Great, thank you for that. And our next question goes to Sheila this time. And Sheila, so Emma wants to know this. Haven't heard much about COVID-19 in less developed countries. What is the impact of disease so far and response? And we've touched a little bit on this, but it would be great to get your perspective, Sheila.
Sure, thanks for the question. I talked about it a little bit before, and others have also alluded to it, that the low numbers that are out there, we think is certainly being impacted by the lack of testing. So I think we're worried that we don't actually really know what the true burden of disease is in many places that we work. In many places, they're just starting to get access to testing, and it's usually centered only in the capital areas, and it's very difficult in a lot of rural areas. So I think the true impact in kind of resource limited settings has yet to be seen, which is always a little frightening, because we're worried about this big onslaught that can certainly happen. We just found out that Malawi, one of our places we work and have been for a long time, just had its first 3 cases diagnosed today, and that had been the one country that PIH works in that didn't have any diagnosed cases. And so Sierra Leone and Malawi, both we know have them, and definitely know that the biggest challenge will be really pushing that testing out. And I think, as I said before, it's really I don't think we know for sure what the impact will look like or what the morbidity and mortality will look like in resource limited settings, just because the lack of a really robust health system. So we're readying for this storm, but I think are all very worried about the impact and the numbers being quite high, and that will yet to be seen.
Great, thank you for that question and the update too from where we work around the world. Joia, the next question is for you, and this time is from Osman. And Osman is speaking from Sierra Leone. So in Sierra Leone, members of the Ebola Survivors Association have suggested that they should be used in the front lines to stem the tide of COVID-19 if and when it gets to Sierra Leone. Already neighboring Liberia and Guinea, two other countries that were affected by the West Africa outbreak, Ebola outbreak, have reported cases. What value would Ebola survivors bring to fight against COVID-19?
Thank you very much, Osman, for that comment. That's a great thought. And, you know, certainly the world has learned, and Partners in Health, we've learned a lot from the Ebola response. And certainly much of the Ebola response was spearheaded by Ebola survivors. So I think people who know what it's like to have a severely contagious disease. And I think there would be potentially roles. We don't want to put anyone in harm's way, and there's no reason to think that Ebola survivors would be immune to COVID, obviously, but people who understand contact tracing, people who understand isolation and how to make people able to be in quarantine and isolation without making them feel isolated, I think could be a wonderful role for survivors of Ebola. I mean, I do think there's always been a place at Partners in Health for people who have had the lived experience of a disease, whether it's HIV, TB, or Ebola. And so I'm sure that that will be considered and should be considered.
Great, thanks, Joia. And Sheila, the next question is for you, and this is related more to a US response. So this is from Lucas. Will you be focusing efforts on the US due to its increasing numbers in comparison to the countries you primarily work in as an international aid organization? How do you ensure to leave nobody behind as hashtag? Sheila, what would you say to that?
Yeah, you know, we're already working the Navajo Nation, and unfortunately, Navajo Nation has been hard hit. There's, I think, as of today, about 214 cases have been identified, and the thought is the cluster is could be quite large. So I think people are very worried about a lot of vulnerable people who live in Navajo Nation, and access to care and access to testing, and in homeless shelters and other places as well. I think we're very committed to helping wherever we can and taking our lessons learned globally to bring to the US. So we certainly are employing those in Navajo and through the COPE program, which we have for years, and look forward to certainly helping in any way that we can.
Thank you, Sheila. This one is from Tori. She says, I live in the United States in a state which has relatively few cases of coronavirus. We're being advised not to travel, but what does this mean? I understand we shouldn't go on cruises or fly cross country, etc., but what about a visit to my friend's house an hour away or to my sister's home down the street?
I can certainly jump in and answer that if needed.
Yeah, why don't you try, Sheila? I think we might have got disconnected a little bit there, if you don't mind jumping in. Thanks, Sheila.
So I think that's a really good question. And, you know, when we're talking about social distancing, the importance of that, and in a place where you live where there's not a lot of identified cases, I can see where that question is often confusing. I think we know, just as in other places, as we've been talking about in resource limited settings, often you don't know cases until they're there. So there could be certainly cases that are many more in your state that you don't know about yet. But even more so, the goal is to really try to keep people to stay home as much as possible. Because even if there's one person who you run into who happens to be the few people in your state who have contracted it, then you're going to bring it back and it's going to be spread. So the goal of the social distancing is really to flatten the curve, which basically means you want to spread out people getting infected so we're not overwhelming our health systems. So I think the overall guidance in most places in the US, and I think that if we all could do this would be the best, is really trying to stay home and social distancing, and even for a period of time, so we can try to get a hold of this and stop the rapid transmission. There's been a lot of states that have really asked for people not to leave. New York has asked people to stay within the state. Other states are saying, you know, if you're coming from another state, please don't come to our state, because trying to get a hold of what's happening locally and within that one state's borders. But we know it's a global, I mean, it's an epidemic that certainly crosses state lines, but the most we can try to do is to keep people as stable as possible, staying home, even for a while, to try to give this a chance to lessen the ability for the virus to travel and impact many, many people in the communities.
Great. Thank you, Sheila, for jumping in on that one too. This is a question from Katie about volunteering, helping out. I would like to shift and take on a more active role as the pandemic burdens are most vulnerable, with increased poverty, homelessness, and disconnection from social supports. How might I best contribute outside of staying home and social distancing when I must go out?
Yeah, that's a really good question. And I think, you know, the one kind of positive thing that COVID has shown, I think, is that people, our communities rally around each other and help each other, which I think is fabulous. And hopefully we can continue this far beyond when COVID leaves. But I think most communities do have a place where you can volunteer if you're living in the US, for example. And it may be via delivering food for a food bank. It could be a variety of different things. There's elders who need people to check in on them. Again, with social distancing, there's certainly ways that healthcare workers who have to go to work and there's no childcare open. There are a series of childcare centers that are open just for healthcare workers because daycares are closed. So I would encourage you to look in your local community and see what's out there. It could be on Facebook or other areas of social media of asking that question. But I think in most places there is a kind of a rallying call for people to help. And if it's done within the social distancing kind of parameters and is hooked into being able to care for our most vulnerable, I think that that's definitely a wonderful thing for everybody to be able to do. You may have to dig a little bit to find out what's happening in your local community, but I bet there's something nearby that would probably very much welcome your help.
Great, thanks, Sheila. And a lot of those questions were pre-submitted, but we do have a number of questions that are coming up here. So I want to have people who are listening in and writing join the conversation here. So we have a couple, and whoever wants to jump in and take it can feel free. This one is related to wearing masks. So there is a debate currently going on about the utility of wearing masks, and B, the use of masks by the population at large, assuming they're available. What are your views? So who would like to take that question first? I'll mute myself. I see Joia smiling.
I mean, I can take that. I don't think there's a clear answer. I would say if you have a pre-existing condition, particularly if you're immunosuppressed on medicines, if you're an elderly person, it makes sense. There's some new data that the aerosolized droplets may spread some distance. The best thing to do is really stay at home and wash your hands and maintain social distancing. Those are the best things to do. What we think masks on the population in general do is protect others from your cough. So I think if you feel that you are coughing or sneezing or coming down with symptoms, to really stay away from others and potentially wear a mask, I think that makes sense. I don't think N95 masks, the more sophisticated masks that keep health workers from inhaling droplets, are being recommended for the community at large. So the simple surgical masks, maybe if you were immunocompromised, considering that. If you feel that you want to protect others from your cough, even tying a bandana or something has been suggested. But what we're trying to do is preserve the N95 masks for the healthcare workers who are at much higher risk.
Great, thank you, Joia. I think that's very helpful. A lot of people have questions about that. Another question here that was submitted: what are the guidelines from PIH on life-saving community-based interventions for vulnerable groups? Who would like to take that one on?
I can take that one. I mean, we were very specific and strategic, I think, in getting out guidelines very rapidly to all of our sites around the world, which have the basic information on testing, on the types of tests, on the types of materials you need, and on the clinical syndromes. But as always, we recognize, and I'm sure all of you calling in do too, that the most vulnerable, poor people, people with other conditions, people with insufficient housing, are the most at risk for life-threatening complications of COVID. And so from the beginning, we have emphasized the need for social supports, food, transportation, mental health and psychological services for vulnerable people, and we've tried as much as we can to build that in to our COVID response from the first day. I think our biggest concern is if we think that isolation, quarantine, and even social distancing are ways to impact the epidemic, that we need to support people to do that, because many of the people around the world we serve depend on going to markets to sell goods and doing other things to feed their family that require being out and about and in the commons. So we understand that isolation and quarantine as measures have to be tied to social support and of course psychological support. So we're trying to work with all our teams around the world to link that psychosocial and economic support with the response.
Great, thank you, Joia. And I think this next one, actually, you should probably take two. It says here, should women who are pregnant but have no underlying health risks take extra precautions?
Yes.
So what would you say?
Yes. Yeah, I mean, I think being pregnant does have some immune consequences. So we know that pregnant women do have a slightly higher likelihood of getting pneumonia, for example. And we've never fully understood what the immune deficit is in pregnancy, but it makes a lot of sense to assume that you would be more vulnerable. And so I think it is very important for women to protect themselves in this time. We have no evidence that pregnant women are more susceptible to COVID. But on the other hand, just in general, we know that pregnant women's immune systems do not respond in the same way as adults that are not pregnant. And so I think it's important to consider yourself vulnerable until we prove otherwise. Great,
thank you for that. And another question here, relates directly to our populations again. Do you have any knowledge of the impact of coronavirus on countries where there is an abundance of malnutrition and where a high percentage of the population already has immune system challenges due to malnutrition?
Yeah.
Go ahead, Joia, you're shaking.
We don't, but thank you for raising that, because that's our worry. We feel quite certain that a significant Ebola or COVID surge would have a much higher fatality rate in many of the countries we work in because of precisely these things. The underlying conditions of malnutrition, HIV, tuberculosis are all extremely common, and we assume that the access to healthcare is poor, and even when healthcare is accessed, the quality of that care and the ability to provide sophisticated care is much less. So we are very, very worried. And, you know, I'm so proud and amazed to see some of the government responses in countries in the global south, because they are tracking and on top of every single case, because I think they're well aware that their populations are quite vulnerable.
Yeah, this next question actually plays right into that, because there's someone listening in who would like to know, in resource-poor countries, is there a concern that the healthcare systems will be so taxed with COVID that those with other illnesses will have lack of access to care? And this reminds me all of Ebola in West Africa. So, Joia.
Yeah, I mean, we are very much focused on supporting our PIH teams across the world to continue to deliver routine care and to set up systems of triage for COVID before people even walk into the hospital, so that we can keep hospitals and clinics operating. But here in the United States and around the world, the fear is that COVID will make it very difficult to perform other services. So that is something that we are working, a lot of our COVID response, I would say, one of the main pillars of our COVID response at Partners in Health is to protect our staff and our patients so that we can continue to provide the care that still, you know, malaria, childbirth, HIV, TB, these are still going to be more common killers than COVID. And so we want to make sure that people can get the care they need despite this, and that it will be a big challenge.
Yeah, I think it is important also. I would link this to the next question around TB and how PIH's experience globally dealing with TB and drug-resistant TB can contribute to the fight against coronavirus. I think we have learned over the last 30 years, that system strengthening is a top priority. That is, it is not only an isolated area of the healthcare system that we need to look at, but it's really a comprehensive approach to look at the diagnostics, about the logistics, about the systems, about the policy that needs to be implemented. So I think translating that experience into fighting this epidemic is going to be a resource, certainly for PIH, based on the last 30 years of experience, and really working very closely with the governments to address the gaps, to identify the challenges, and to be able to provide also the care and support, social support also for patients. I think our experience working on patient care, also dealing with drug resistance in countries like Russia or Peru or Kazakhstan, our experience doing clinical trials, strengthening diagnostic networks, is helping us to contribute to this response nowadays.
Thank you, Daniel. That was great. We have another question here. Can PIH consider preparing a brief to aid persons who are emotionally coping with social distance, and provide any guidance? And I'm just going to do a shameless plug here for a story that has been circulating. Actually, Dr. Ppe Shortages, who's the director of our mental health program, put together 10 really helpful tips for people dealing with social distancing, and you can find it on our website, pih.org. So anyone want to take that, I guess, as what's some helpful tips and advice as we're all learning how to social distance around the world?
I can start that one. So I think, as definitely looking at Peppe's tips is important. And I think he's talking a lot about the need for, it's really not social distancing, but physical distancing. So certainly we have to physically keep away from other people who are not in our immediate families, but it's also important that you still remain connected with people on the phone, on social media, on other aspects of, there's a lot of online communities that are being formed that people are meeting to do Zoom and other types of platforms of getting together and spending time together like they normally would. There was a series this morning on NPR about online exercise classes that are happening in live in real time. So I think that's a piece of it, is certainly still remaining in contact with your community and not self-isolating yourself away from the world, but more physical distancing. Also, self-care is an important piece of trying to get exercise and eat as healthily as you can during this time, and certainly reaching out for help if you're feeling despair or you're feeling that things are overwhelming. Trying to reach out for help during this time is also very important. And this is going to last for a while. We don't know how long. So I think as we learn how to support each other virtually and are creative in those ways, the better off I think that we'll all be to support each other.
Great, thank you very much, Sheila. This next question is great from a registered nurse, so right up your alley too, Sheila. I am a registered nurse working in the operating room. Many people have reached out to our organization offering to sew cloth masks. What are your thoughts on the effectiveness of these masks? We would not use them in the OR, but what about for public use? And I know some of my friends on Instagram are posting pictures of what they've sewn at home. And I guess that's my question. Can they be used? How? Where?
Yeah, you know, I think we don't know the effectiveness of these masks. So definitely for healthcare providers in the operating room or doing any type of care where there could be aerosolized particles in the air, I think that the cloth mask, we just don't know. So is probably not our best bet. I think the N95 mask, we know certainly that it does screen out 95% of the bacteria that's out there. So I think they're probably fine for people to use, as Joia said, to kind of have some barrier with someone's own coughing and things like that. But for treatment in the hospital, particularly in the OR or any place where people are taking care of sick people, I think because we don't have any data on it, I don't think cloth masks are certainly the answer. There unfortunately are places where, even in hospitals, where there's nothing. So I think if there's nothing, certainly some barrier is better. But I think it's very important that we advocate that our healthcare workers have access to what they need and the best, highest quality that we can possibly get. And I think there is a movement around that I think we all need to be very much a part of, because it's really critical that our healthcare workers remain healthy. And this is, the PPE and the lack of PPE has certainly been one of the big disappointing things, I think, for many of us who work in healthcare, and the lack of access. So I think cloth masks, we don't really know the effectiveness of it, and certainly wouldn't advocate in a healthcare setting unless there's options for nothing else.
Great, thank you, Sheila. And I think you were going to take this next question possibly to just talking about timelines. I know that individual countries have different capacities and different ways of dealing with the coronavirus, but what is the most possible timeline that we will be all living in this situation? Sheila, did you want to take that?
Yeah, I don't think we know for unfortunately, and I think that there's a lot of modeling that's being done, but I don't think we know. And I think that we certainly know that if places that have had the physical and social distancing in the most severe or the most kind of concrete ways have had a faster response of getting the virus under control. We certainly know in China, for example, they had very strict guidelines, and they were able to get the virus under control more rapidly than other places. So I don't think we know the amount of time. I think we're all starting to go a little stir crazy, but I think we have to hold on and see what happens in the next few weeks. But I would be very surprised if in most places in the US, for example, where this would be over in a few weeks. I think that in most places where many people are talking about beginning of June, and I think a lot will be revealed in the next few weeks, unfortunately.
Thank you for that, Sheila. This question is great, and for expectant mothers or young mothers, what's your advice for breastfeeding mothers who test positive? Who would like to take that question next?
Wow, that's a tough one. You know, there was a baby that just died with coronavirus, so I guess at this point, if the person who's positive has a baby, I think it might make sense to, I mean, certainly they should talk to their physician first and a lactation consultant and really get the professional advice about that. But there is, I just want to make sure people don't think babies and children are immune. While it does seem that they don't get quite as sick, there have been deaths among infants and small children. So just, I think I would defer that question to specialists and not feel comfortable answering that.
Thank you, Joia. That's great advice to contact your doctor individually too. So I think we'll take a couple more questions here. This has been really great, some excellent questions. The next one is a bit of modeling disease. So is PIH working on predictive models to forecast COVID-19's impact in low to middle income countries in terms of hospital resource use? Have we been involved in any of that activity? And who would like to take this one here?
I can take that, Leslie. Definitely, we have our research team led by Dr. Megan Murray has been looking at models for places like Malawi, and fortunately, you know, we've always been advocating for better systems for ICU care. We've been always advocating for oxygen. So these are things that we've been looking at for a long time. We're not scrambling to say, oh, we never thought of that. But then to prepare the level that will be needed for this outbreak, that's a whole nother matter. And unfortunately, even in places where we've done a lot of improvement of infrastructure, there are still very few ventilators, insufficient supplies of oxygen. So we are looking at that and modeling that. But unfortunately, I think it will be nearly impossible for many places to catch up in time. And so the most important thing right now is contact tracing and trying to extinguish the epidemic in the world's most impoverished countries.
Great, thank you, Joia. I think we'll take the one last question here, maybe quickly. It's about social distancing where we work. You know, it's a different world, right? So you had mentioned that an important part of all of this prevention work is you know, social support in developing countries and communities. How could this be done in places like where PIH works, social distancing and social support simultaneously? What are the considerations we have to take into account?
So I think that there's certainly ways for social support of leaving food for people, leaving water for people. I think social support in terms of basic needs can be done with social and physical distancing. And I think that there's a lot of creative ways that is happening. I think we know that if we're asking people to isolate or for periods of time, that we have to make sure that they do have access to food and water and what they need, if they need transportation, if they do get ill, etc. So I think there certainly can be creative ways of physical distancing and providing basic needs for people by setting things up in a place that somebody drops it off and picks it up and that things are wiped down. But I think the most important thing is to make sure that we are doing this in a robust way so that we can make sure our most vulnerable people are able to keep themselves safe by isolating if they've been in contact with others, to keep the community safe, and also that they have what they need so that they're not battling hunger and things like that while they're in the process of battling this epidemic that, like all of us are. So social support is a key component of all of our care at Partners in Health, and certainly with COVID, a huge piece of this as well.
I also, one thing I've reflected on a bunch recently is that, I don't know if it's on me. It's on me? Yeah. One thing I've reflected on a bunch recently is that we also have to allow people to declare themselves vulnerable without too many questions, because I do think we need to respect people's confidentiality. And within our office environments, within our ranks, there may be people with HIV, there may be people with rheumatoid arthritis, and other vulnerabilities. And I think we have to have kind of a generosity about people who do not feel that they can go back into the workplace right away, and be able to protect their confidentiality. That's something I've been thinking about recently.
That's great, Joia, and I really want to thank everyone here who participated. Joia, Sheila, Emily, Daniel, really some wonderful, thoughtful comments and excellent questions, frankly, from the audience. So thank you for participating, and we'll just bring up the last slide that we had, Dan. And so for more information, if you do want more information, please visit us at PIH.org. And we have a specific Stop COVID segment. So just look at the top bar, you'll see the red tab, and you'll get all the information about our response around the world. Really appreciate your attention today, and make sure to continue to follow us on social media through Twitter, Facebook, Instagram, and every other way that you follow your favorite organization. So thank you very much, and thanks to everyone who joined our call.